You are watching McLaren Port Huron Today's Health, and today I'm speaking with fellowship-trained orthopedic spine surgeon Ryan Goodmanson about conditions that affect the lower back. And in this segment, we are speaking about lumbar disc herniation. So, Dr. Goodmanson, can you tell us what that is?
Sure, Kelly. I'm going to use a model because picture's worth 1,000 words. But lumbar disc herniation, and the easiest way to think about this is the disc between the vertebral bodies just kind of gives out. And if you think of it like a jelly donut, if you have the donut with the jelly in the middle and the jelly squirts out, that jelly has to go somewhere. That's kind of similar to what a disc herniation is. The disc herniation, or the disc, the jelly from the jelly donut, will kind of squirt out the back, and what it causes is it causes stenosis, kind of like what we've talked about before. This pushes on the nerves and can cause intense pain. It can cause pain in the distribution of the nerve, and it can cause weakness in that nerve's distribution as well.
Is this usually like a sudden symptom, or is this something that is gradual and can increase over time?
It can be both. Sometimes it's a traumatic injury where a patient is lifting and twisting and they feel a pop in their back. It's very common. The pain will then shoot into their back and down their leg, and it may not go away. Sometimes over time the disc can wear out and then it herniates, and you get a similar problem. However, it's just a more gradual onset.
And are the symptoms the same?
The symptoms are very similar, yes. Pain in the back, pain down the leg in a very specific distribution that goes into the foot usually, and pain with usually lifting, bending, and twisting.
So how would you diagnose this condition?
We always start with a very thorough history and physical exam because you know your body better than I do. But when you come in, and if I think it's necessary, we will order MRIs usually to evaluate the discs and to look for a disc herniation or any pressure there may be on the nerves.
Are there any non-surgical options for treating disc herniation?
Definitely. Most disc herniations actually will resolve on their own. There are very few, however, that will not. Conservatively, we can do things like physical therapy, anti-inflammatory medications, and muscle balancing to help with this until the disc resorbs and your body takes care of it on its own. If it can't do this, or you continue to have pain, injections are a good next step in the back to decrease the inflammation that this causes around the nerves, which could help with pain. If that doesn't work, then you come back and see me and we take care of it.
Yeah. So when is that time? What do you tell patients? This is what you need to look for and call me.
Yeah. Usually, if they're having intense pain that just doesn't go away with any of those other modalities of treatment, if they have severe numbness and tingling or severe weakness in their leg, that becomes a little more urgent of a situation. And then it's kind of a time factor. If it's been going on for somewhere around 2 to 3 months and they're just not getting better, we won't wait any longer. We would go in and we would take care of it for them.
So let's talk about the surgical options. Can you give us an overview of what happens during the surgical procedure?
Sure. The surgical procedure is usually what's called a microdiscectomy. So we use a microscope to do a very careful and thorough dissection down to where the herniated disc is. We remove a small portion of bone to make a window so that we can see the disc and the nerves, carefully protect the nerves, and then scoop out that disc herniation so it no longer pushes on the nerves in the back.
So what would the anticipated recovery be for a procedure?
Most of the time patients do very well from this procedure, and they can even have pain alleviation that day. Now, surgery is surgery and it can still hurt, but usually the patient is up and walking that same day. They will go home the same day or the next day depending on how they do. And then in the next 3 weeks to 6 weeks, they are doing very well and usually back to their normal life.
Thank you so much for this information. It's very helpful for our audience.
Thank you, Kelly.
This completes the segment of McLaren Port Huron Today's Health. If you would like to make an appointment with Dr. Goodmanson, you can call his office at the number on your screen, or you can request an appointment through their website. More videos on other health topics are available on our website at www.mclaren.org/PHTH. This is Kelly DiNardo for McLaren Port Huron Today's Health.